Hello, Don here. Welcome to Podiatry Practice Mastery, where we're helping you get your practice to the $1 million mark and beyond. I wanted to thank a couple of people. They sent me an email wanting my treatment sheets, so if you guys want them, happy to send them out. Just shoot me an email, don@podiatrypracticemastery.com. They really kind of help my practice. The main ones I use are like for plantar fasciitis, Achilles tendonitis, and nail fungus. Those are the main three. And it has kind of the whole protocol listed out for patients, so it makes it a little bit easier for them. So if you want that, just shoot me an email. Okay, so I want to go through, this is a recording of a Monday. First patient was a pre-surgical discussion. I'm going to be doing a neuroma removal, so I have a patient presentation on that, and I kind of go through that every time. And this patient even commented, wow, that's nice. And I find the patient presentations really just kind of simplify so we don't skip things. So if you're interested in those, go to patientpresentations.com. You can get access to all mine and kind of use them for your practice. So that was I also sent over the prescriptions prior. So within my medical record, I can send them. I send them usually. I do surgeries on Wednesdays, so it's the Friday before. So I sent that. It shows up the Friday before. Next patient was a 20-year-old female. She had a lytic, wavy, big toes. So I did a nail sample and I talked to her about doing KeryFlex. She would be like a prime candidate for that. Next patient was a follow-up after a cortisone injection with plantar fasciitis. She is like 95% better. She's doing great. I did tell her that if it gets past the 3-month mark, that's the the new normal. But if the pain does come back, then we would do another ultrasound and maybe some shockwave. Next patient was a 74-year-old man for Qutenza number 1, and so he has some diabetic neuropathy and has been quite a bit of pain. Next patient was a 90-year-old patient that had some plantar fasciitis pain and a lot of bad equinus. And not too common on a 90-year-old, but the pain was there. So I did a cortisone injection, and then I put them in a night splint, and I did my whole, my like they call it the Pelto special, which is foam rolling, morning stretch, and then the night splint. Next patient was a 59-year-old that had plantar fasciitis and Achilles tendonitis. And they came back after seeing someone else for soft wave. So they saw a chiropractor for soft wave. I did ultrasound, and we talked through this patient, kind of what we were going to do for him, working more on the soft tissue release initially with physical therapy, and then if that doesn't work, then doing a few more rounds of the shockwave. The challenge is, like, I think some people, when they use the soft wave, they move it around a lot, and I tend to focus right on this area. But the problem is he has really low-level pain, like a level 1 or 2, so it's not that much. And I actually told him to get back to doing his running and seeing how his foot adjusts with more of a stability shoe for him. Next patient was this is like one of these, when you go into the treatment room, you just take a big breath, and you have to kind of treat this one. This one here, she was in a wheelchair, had been in a wheelchair for a number of years. First MPJ pain. She requested like arthrogram, like, so he was doing a lot of seeking online. I recommended an MRI. Was just really talking. Wanted to try everything, but didn't want to do anything. And so those ones I don't have as much patience for. I can usually handle one per day like that. But I recommended an MRI, so we'll see where that goes for that patient. Also asked for like a handicap placard as well, so I did that only just to give me peace of mind. Next was a 56-year-old that was a matrix left hallux on both edges. See them back in 3 weeks. Next was a 59-year-old, came back for a nail sample follow-up, had fungus, tinea. I put them on the kit, which is my terbinafine, and then they do the UV light and the shoe spray and the biotin. Next patient was a sesamoid fracture guy. He's already starting to feel better, which I'm happy for. He's number 6 out of 6 shockwave. I'm going to see him back in 6 weeks. Next patient was a fracture of the third met, 19-year-old, a little girl, put her in a cam boot. Next patient was a 58-year-old that had one of these like split fifth digits, like longitudinally, so I trimmed that back. So it was thickened, so nail debridement. Had also an ingrown toenail that I just educated her about, and then she had a IPK on the left second met head, so I did lesion destruction on that. Next patient was a 15-year-old that had MRI. This is another patient. Sorry, it wasn't that one. This is a 69-year-old. That 15-year-old was the fracture. The 69-year-old was this female. She has a lot of bad subtalar joint arthritis. Got an MRI. I'm going to refer her to my my colleague here for a subtalar joint or a triple arthrodesis. Next patient was an ulcer patient. He had a little bit of an ulcer on the medial second toe after cantharidin, so a little bit of cellulitis, gave him antibiotics, de-roofed it. And I had another patient that had it cantharidin done. He got a cellulitis and had to be admitted. So I'm just feeling like this new cantharidin that we have might be a little bit stronger than the other one. So that was something that was kind of disconcerting to me. Next patient was a 44-year-old that had a follow-up on diflucan. And he's going to try that and continue that. But if that doesn't resolve everything, I'm going to put him on Sporanox. Next was a 49-year-old male. He had kind of diffuse foot pain when he's working. He works at Macy's on his feet all the time, so I recommended new shoes and over-the-counter inserts for him. I think a lot of it is just standing all the time. Next patient was number 4 out of 6 for insertional Achilles tendonitis. This gentleman, he's going to be traveling soon, so he wanted to do shockwave every 3 days. So he's kind of getting these done twice a week, basically, or like every 3 days or so, avoiding the weekends. But he's already starting to feel better at session 4. Next patient was a follow-up for an 82-year-old female. She had some like painful calluses, put a crest pad on her hammer toes, and she was going to come back as needed. And then finally there was last patient of the day was a 5th metavulsion fracture, so I put them in a cam boot. So it was a good day on the office. We added a new, I think I told you, an urgent care page. So if you want to see that, you can go to our website, centralmasspodiatry.com. Try to kind of focus in on getting some urgent care patients. And I've been doing some YouTube shorts on urgent care. So basically patients that probably should have came to see us instead of the urgent care because it just was 2 visits versus 1, and it really wasn't that, they really couldn't do so much for them. So I'm going to put these YouTube videos on that page. So that's how I kind of utilize my time. So I try to, these days I've been trying to utilize my time making YouTube videos with the patients in the treatment room. So basically there's a component of like how can you use sawdust, like what's left over, what I have, and how can I make content and make value out of that. So I find a lot of times just documenting the process with patients makes it a lot easier to make content versus being really, really creative. You just document what you're doing. And I find this thing I'm using called SubMagic is really the easiest. So I do it right through my phone, record it, doesn't save to my phone, goes right up to SubMagic, and I have my virtual assistant do the other things, and they post it on my YouTube. So if you want to see that, you can go to my YouTube, Dr. Pelto, at YouTube. Okay, once again, hope you guys find this beneficial. Any other ideas that are working really well for you, shoot me an email. I'd love to hear, and I'll share those with other people. Don at podiatrypracticemastery.com. Thanks.